It's a warm welcome here in our studio in Serekunda. This is Star TV News and I am Sarah Kamara. In the headlines tonight, Bakau Craftsman calls on government for solution as COVID-19 continues to affect all business sectors in the country. Bara Shipwrights complains of wood and electricity shortages. SL District Hospital not well equipped to help tackle COVID-19. And on the international scene, coronavirus lockdown, South Africa orders 3 weeks restriction. Trump considers reopening US economy despite coronavirus spread. UK locks down 66 million people to slow spread of coronavirus. Those were the headlines and now the news in detail. Since the first case of coronavirus has been confirmed in the Gambia, many businesses are not going as usual, and the Bakau craft market is not an exception, calling on government to come up with solutions. Star TV Binto Koli spoke to some craftsmen who voiced out how COVID-19 affects their businesses.
Seni Singate, president of Bakau Craft Market, said business is not going as usual, as most of their customers are not available to buy their products. According to him, the suspension of the flight landing in the Gambia will have a negative impact on their businesses. Mr. Singate added that the tourist season is only 6 months and whatever they generate within that 6 months is what they use to sustain their families and other basic needs. We are people that work from hand to mouth and having to go through all these difficulties is not helping, an emotional Seni lamented. He urges the Ministry of Tourism and the government to come to their aid and bring possible solutions that will help them greatly in their businesses and their families as well. Anja Sar, who is also in the craft industry, said business is very dull at the moment, revealing that many of her customers have contacted her saying their governments want them to go back to their countries in order to prevent themselves from the COVID-19, which is a good idea to help reduce the spread of the virus. Anja is optimistic that the craft industry will go back to normal whenever the pandemic is over, even though she does not know when that will be. Modu Wang, who has also spent 36 years in the craft industry, revealed that since the outbreak of the coronavirus, they have been going through a lot of difficulties because customers are not coming as often. He said he is the breadwinner of his family and that means a lot of dependence. Going to work for a whole day and going back home empty-handed is really sad and frustrating to him. He advised the government to do more awareness program on both radio and TV stations as that will help greatly, and he was quick to add that the general public should adhere to the advices given to them by health personnel in order to protect themselves. For Star TV News, I am Binta Kuli.
Shipwrights in Bara have complained of wood and electricity shortages in Bara as it slows down their businesses. They made this complaint while speaking to our reporter Maria Madem on Saturday in Bara, North Bank region.
Shipwrights in the Gambia who inherited the skills of boat making from their fathers in Senegal came to the Gambia in 2002 as they established a shipyard in Bara. They make living out of boat making for many years, but due to some difficulties they faced in the process, it has hindered their work. Patesar, a shipwright, says lack of electricity has slowed down their work as it used to take them only a week to make a boat. But due to electricity and wood shortage, it now takes them for a month or so to finish a single boat. Mr. Sar added that boat making business is really good in the Gambia as they sell a boat for about $150,000, but pricing depends on the size of the boat. He further says that they really need to work in order to pay their taxes and make a living, and he finally urges the government to support them in the electricity shortage issue. Falu Sow also made similar remarks, saying that the only challenges they encounter is the electricity shortage. He added that he enjoys working as a shipwright in the Gambia because the place is conducive. They further encourage Gambian youths to involve in boat making and stop going to back way as it is a noble profession without any risks. The boating industry has grown dramatically. The influence the marine industry has on the economy, tourism, and the environment creates a significant impact on communities surrounded by water and aquatic activities, and the Gambia is not an exception. While some of these impacts can be negative and many can be positive impacts. Maria Madam, reporting for Star TV News.
The administrator of Esau District Hospital, Lamin Fofana, has revealed in an interview with Star TV that the hospital is not that much equipped to help tackle the outbreak of the novel coronavirus despite receiving limited resources from the Ministry of Health. Jacqueline Koli was in Esau and she now reports.
Mr. Fofana said despite the limited resources available at the hospital, the staff and management of the hospital had put in measures to help sensitize the people on the COVID-19 global pandemic.
As a facility, have also put in measures whereby we can sensitize the population and also to provide hand washing stations which are located in various strategic places within the facility. And we have also provided hand sanitizers to the staff of the facility, so that it will also help us to prevent ourselves as healthcare workers, because we are the first contact of patients, and considering the location of Esau District Hospital with a catchment area population of over 60,000, and we are very close to the Amdalai border post too. So we have also been receiving trainings which have been organized by the Ministry of Health and their stakeholders, all geared towards increasing the level of awareness of the staff and the population. So
Fofana narrated that they received some personal protective equipment from the government recently.
Complacent as a facility. Just yesterday, we have also received some PPEs from the Ministry of Health through the Central Medical Store. The PPEs are the personal protective equipments, which comprises the gowns, the goggles, the face masks, and all. It is a whole package. And in that, we also receive some face masks, which we need to commend the Ministry of Health. It's most especially the Minister of Health himself, who has been very much passionate about the welfare of health workers in the country. And the Regional Health Directorate are also on the ground trying to ensuring that the nurses are well protected and they follow the infection control guidelines. Yeah.
He further revealed that there is a ward reserved for isolation in case there are any suspected cases. He said they made sure the ward had the required number of beds and space. He added that the officer in charge, Mrs. Sira Conte, took it upon herself to make sure there was a hand-washing basin stationed at the nurses' ward located at the isolation ward. Mrs. Sira Conte, the officer in charge of the Esau District Hospital, advised on the usage of the surgical mask as a way of preventing a person from contacting the virus.
Using the mask is not a way of preventing the coronavirus. There are protocols that you need to follow. If you are caring for somebody who is coughing or sneezing or have the signs and symptoms of coronavirus, that's the time you should put on the mask. Or you yourself as a health personnel, you are coughing and sneezing, that's the time for you to put on the mask. It doesn't mean that if you are going outside, you have to put on the mask, because you also need to care for the mask. You cannot put on one mask for 24 hours. And then the mode of disposal also is very, very important. The essence of you putting on the mask is to prevent the transmission of the coronavirus.
Mrs. Conte stated that the most important preventive measure is hand washing with sanitary materials like soap and chlorine. She advised the public to stay at home at all times and wash their hands frequently to avoid the transmission of the virus, and visit the nearest health facility if one has the signs and symptoms of the novel virus. The Gambia has now recorded 2 confirmed cases of the coronavirus, but a second infected person passed on. The disease was said to have come into the country from Senegal, and he is said to be a citizen of Bangladesh. Jacqueline Koli reporting for Star TV News.
And now, news beyond our borders. South Africa has announced a 21-day lockdown starting at midnight on March 26, 2020. President Cyril Ramaphosa says it is necessary to avoid a human catastrophe and has instructed the army to enforce the restriction. More than 400 people in South Africa have been infected with the coronavirus. Al Jazeera Famida Miller reports from Johannesburg.
The number of cases of COVID-19 in South Africa has increased 6-fold in recent days. From 61 cases just over a week ago, there were 402 by Monday. For the government, an alarming escalation, leading to the announcement of a 21-day lockdown by the president.
It is clear from the development of the disease in other countries and from our own modeling that immediate, swift, and extraordinary action is required if we are to prevent a human catastrophe of enormous proportions in our country.
Only essential workers such as police, healthcare workers, and those working in food services will be allowed out. People will only be allowed to leave their homes for medical care or to buy food and medicine. The army will be deployed to ensure restrictions on movement are obeyed. A travel ban from high-risk countries is already in place and schools are shut, all designed to reduce the spread of the virus. For many, this is a welcome move by the president. There have been calls from labor unions, doctors, and thousands of others across the country for swifter action. For a country already grappling with an almost 30% unemployment rate and low economic growth, the lockdown could be disastrous for the economy. But for the government, the drastic measures are necessary to save lives, no matter the cost.
Our country finds itself confronted not only by a virus that has infected more than 250,000 people across the globe, but also by the prospects of a very deep economic recession that will cause businesses to close and many of our people to lose their jobs.
The government says it will create a temporary compensation fund so that businesses can avoid having to fire staff, as well as provide tax relief for small businesses. Experts estimate that without taking drastic steps, the number of infections could increase to between 3,000 and 4,000 by the beginning of April. As the global crisis deepens and the number of COVID-19 cases has more than doubled in a single week, the South African government warns that the next few days are crucial for millions of South Africans. Famida Miller, Al Jazeera, Johannesburg.
President Donald Trump says he would like the United States to revive economic activity soon despite issuing guidelines to curb unnecessary travel last week, as death from the coronavirus hit 100 on Monday. He says the U.S. was not built to be shut down, and analysts say Trump is concerned that Americans will vote him out in November if the economy has not recovered by then. The U.S. is reeling as lockdowns in the country threaten millions of jobs and legislators failed to pass a more than $1 trillion rescue package. Al Jazeera Heidizu Castro reports from Maryland.
The streets of Manhattan are empty, reminiscent of the days after 9/11. But within New York's hospitals, doctors say they're under siege. The number of cases across the country has soared.
If we don't get control of this quickly, like in the next 2 to 3, 4 weeks, our hospital systems will be overwhelmed.
Under mounting pressure from state governors, President Trump says his administration has shipped 8 million respirator masks. He's also signed an executive order to prevent the hoarding of critical medical supplies.
But if you are sitting on a warehouse with masks, surgical masks, you will be hearing a knock on your door.
More than 100,000 Americans are under orders to stay home. Despite the growing number of cases, Trump says he hopes to reopen the country soon.
We are not going to let it turn into a long-lasting financial problem. Started out as a purely medical problem, and it's not going to go beyond that. We're just not going to allow that to happen.
Meanwhile, Congress remains at a stalemate over a nearly $2 trillion economic rescue package. The Republican plan stalled by Senate Democrats.
The bill still includes something that most Americans don't want to see: large corporate bailouts with almost no strings attached.
The government is also fast-tracking experimental drug treatments, one endorsed by President Trump as a possible game-changer against the coronavirus has not been proven effective in a clinical setting. And an Arizona man who self-medicated with the drug to treat his coronavirus has died. Heidi Jo Castro, Al Jazeera, Maryland.
The United Kingdom Prime Minister Boris Johnson has ordered all citizens to remain at home for at least 3 weeks to stop the coronavirus pandemic from spreading further. Only essential travels for certain jobs to get food, medical supplies, exercise would be allowed, he said, as the death in the country from COVID-19 jumped to 335. Al Jazeera, Neve Baker reports from London on the situation there and has the latest from Europe.
It was an announcement no British Prime Minister has made since the Second World War. Unprecedented restrictions on people's way of life.
You must stay at home, because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home.
Following the example of France, Germany, Spain and Italy, police will now have the power to issue fines and enforce closures. Britain's been watching developments in mainland Europe with growing unease. But while London landmarks are deserted, this was the scene on the city's underground on Monday. The advice is clear, and so are the risks. But crowds are still gathering at this East London market. While there's still demand, stallholders say they're left with little choice but to carry on selling, and shoppers keep on buying. The local authorities are painting footprints on the tarmac to help people maintain physical distance. But like many of the guidelines, nobody's paying any attention. This is one of the cheapest places in the area to buy food. Shutting it down could have dire consequences on people's lives and livelihoods. It is a difficult decision to make, but every infected person runs the risk of infecting several others. The domino effect could be catastrophic. In Italy's Lombardy region, cemeteries are struggling to keep up with the dead. On Monday, the death toll climbed to more than 6,000. But for the second straight day, the number of dead edged down and the rate of infection slowed. It's too early to say whether Italy's turned the tide on COVID-19, but the figures offer some hope that government measures are working. A day after Italy shut down all non-essential economic activity, now more restrictions, a ban on all internal travel. The virus has distorted everyday life. Buying food can take many hours. The streets of the German capital Berlin are also empty, and the country's Chancellor Angela Merkel forced to quarantine. But there's a glimmer of hope. New data suggests the spread of the virus is slowing. Despite a high infection rate, there are relatively few deaths in Germany. The country was quick to introduce widespread virus testing.
One core element is the ability to keep track of contacts. The quarantine of contacts are kept for 14 days, and the isolation of infected people. These measures must be kept up and strictly adhered to for the coming weeks and months. They are important and will remain important.
2 weeks into its lockdown, Spain is now considering extending it further. The virus has swept through dozens of nursing homes. Many of the residents didn't stand a chance. Soldiers are now battling to contain the spread. Country after country, governments are controlling the lives of citizens like never before in an effort to save lives. The coronavirus has pushed a continent into confinement. Neve Baker, Al Jazeera, London.
More than half of India is under complete lockdown as the government tries to contain the spread of COVID-19. There are 468 confirmed cases and 9 deaths. While most people follow the government orders, there were desperate scenes at both stations as migrants workers try to return home. Al Jazeera's Elizabeth Puraman has more from New Delhi.
This is what the Indian government wanted to prevent hundreds of people crowding together. Migrant workers in the state of Bihar filled overcrowded buses, some even climbed on the roofs, in a desperate attempt to return to their homes.
So we saw this bus and came and sat here and thought that the driver must be somewhere, but no one was here.
Authorities are saying that the bus will go, but how will we go? We just keep waiting.
Migrant workers around the country tried to catch buses after Indian Railways cancelled train services which carry more than 25 million commuters a day. all interstate buses and metro services are also cancelled until the end of the month. The Ministry of Civil Aviation announced all domestic flights will be suspended from Wednesday. Prime Minister Narendra Modi tweeted, saying many people are still not taking the lockdown seriously, even though most public places were deserted around the country. Many regional leaders, including in the capital territory of Delhi, said they would take action against anyone who violates the measures.
अब सब लोग आज के बाद लॉकडाउन का पूरा पालन करेंगे.
Now everyone from today has to obey the lockdown completely. The lockdown started this morning. Maybe you had to go out for some necessary work, but from tomorrow the government will enforce the lockdown and will use force to ensure it.
Arvind Kejriwal also announced financial and humanitarian assistance to those affected in Delhi. As the Indian government introduces more restrictions every day to limit the spread of the virus, many who've lost their livelihoods or have been stranded are also hoping to hear how the government will help them beyond telling them to stay at home. Elizabeth Puranam, Al Jazeera, New Delhi.
And before we end the news, a recap of our main headlines. Bakau craftsmen call on government for solution as COVID-19 continues to affect all business sectors in the Gambia. Various shipwrights complain of wood and electricity shortages. Esau District Hospital not well equipped to help tackle COVID-19. That's all for this edition of the news. Please enjoy the rest of our programs and join us tomorrow for more news. Thank you.